So guys, the next thing that we are going to talk about is the basal ganglia, which is also called as a basal nuclei. For this topic also, the orientation is very much important because we need to understand how exactly the basal ganglia is oriented, where the lateral and the medial part of the basal ganglia is located, how internal capsule is separating the components of the basal nuclei. So let us start with very basics first. That basal ganglia, if I say anatomically, it consists of something called as corpus striatum. Basal ganglia consists of corpus striatum. It also consists of the claustrum. Claustrum, remember that thin sheet of gray matter which was present just lateral to lentiform nucleus? We saw it in the transverse section. And it also consists of the amygdaloid body. This consists of the amygdaloid body. Functionally, or you can say physiologically, apart from these three, other components which are also considered as the part of the basal ganglia are substantia nigra of midbrain, substantia nigra, subthalamus, and even red nucleus. As per few authorities, it is also considered the part of the basal ganglia. So please understand, anatomically, it's the corpus striatum, claustrum, and amygdaloid body. These are the anatomical component of the basal ganglia. These are anatomical component. But all these, including these three also, subthalamus, substantia nigra, and the red nucleus, because you'll see some fibers coming from these region and going to these part also, they are all considered as the functional component of the basal ganglia. So that's just first a very basic thing about that. What are the parts of basal ganglia and how much is the anatomical part and how much includes the physiological part as well. Now, as I said, the first very important thing is to understand that basal ganglia, which is having all these lentiform nucleus, putamen, and caudate nucleus, now where they are located and how they are continuing with each other. Now, in the previous discussion of the white matter, we took a transverse section of the brain, and I hope you remember that we saw that internal capsule is the one which is lying between lentiform nucleus laterally and thalamus on the medial side, and the caudate nucleus also. So let us look at this continuity, how it looks like. Now imagine, I want you to imagine this thing, and then please draw it with me as well. Imagine this time you're looking from the outside. Now when you see it from the lateral surface, so obviously first we are supposed to see the lentiform nucleus. Then next to lentiform nucleus should be what? Internal capsule. And then next to internal capsule should be the thalamus. So I'm gonna go from inside to outside, but we are seeing it from the outside. We are seeing it from the lateral side. So just take your time and just draw this thing so that you have no issue with the orientation. Let's say, guys, this is thalamus here, right? Yeah, again, I'm saying you're seeing it from the lateral side, so you're looking at the thalamus. Now, what do you expect to see lateral to thalamus? What was lateral to thalamus? It was internal capsule. So if this is thalamus, it's better if we highlight that part. If this is the thalamus portion, and lateral to the thalamus, we got internal capsule. Let's say these are the fibers of the internal capsule. There we go. So all these are the fibers of the internal capsule. And what is lateral to internal capsule? We said lentiform nucleus. So guys, lateral to the internal capsule is the lentiform nucleus. Let's say this here is the lentiform nucleus. Let's just fill it up so that you can imagine it is lateral to it. Now this lentiform nucleus, essentially it continues with this comma shaped nucleus which goes like this. This is called as the caudate nucleus. As the name suggests, caudate nucleus, the comma shaped nucleus. The comma shaped, this caudate nucleus is running on the thalamus. See, if anything is running on the thalamus, that means this has to be lateral to the lentiform nucleus. So this comma shaped nucleus which will run this medial to the internal capsule, or you can say above the thalamus, we will continue down like this and will continue with the amygdaloid body. This is for the orientation part. So guys, this nucleus here is the lentiform nucleus. This is internal capsule. These green color fibers which I'm drawing, let's say these are the internal capsule. This of course is the thalamus part, which is medial to the internal capsule. There is the caudate nucleus, and then you see this caudate nucleus coming down medial to this internal capsule, and it is continuing with this amygdaloid body. That is how this thing is oriented here. So we got the lentiform nucleus with which you will see the continuation of this caudate nucleus, which goes medial to the internal capsule over the thalamus and then comes down and continues with the amygdaloid body. So that's about the orientation part. Now, when you see the word corpus striatum, now there are more than one thing inside the corpus striatum. I hope you drew this part. So guys, corpus striatum, the word corpus striatum is a slightly vague term. Striatum is because of the striations inside. The corpus striatum is having the lentiform nucleus. It's the lentiform nucleus, as well as we have the caudate nucleus inside. The lentiform nucleus, this one, and the caudate nucleus also. And as we said, the lentiform and caudate nucleus, although they look like the two separate units when you saw it in the transverse section, but in the inferior part, you will see that lentiform nucleus is giving off the fibers to connect with the caudate nucleus. And those fibers, they look like striations. That's why the word is corpus striatum there, because of the striations here. What we already know from the previous discussion, that lentiform nucleus is having two parts. When you see it from the lateral side, it was what? It was putamen, and medial part is the globus pallidum. So guys, let us say this is the globus pallidum, which is present medially, and laterally we have this larger part, that is the putamen part. The thing is, the putamen part here and the caudate nucleus, these are the one which are actually connected by those fibers I was talking about, and that is called as the striatum or the neostriatum. Developmentally also they are more developed and they came late in the picture, so we call them neostriatum. It's the caudate nucleus and putamen together are called as the neostriatum. They call as a neostriatum. Whereas only the globus pallidus part, which is a medial part here, is called as paleostriatum. This is a component of the paleostriatum. So corpus striatum, we said having two components, lentiform nucleus and the caudate nucleus. Lentiform is actually having two parts. We have a putamen and we have globus pallidum. So that this the putamen part over there, which is lateral one, and the caudate nucleus, which are continuing with each other by the white matter, that is what you call as the neostriatum. Just to remind you once again, if this is the internal capsule, here we got the head of the caudate nucleus. This is how the thalamus, we drew the thalamus, and then we said this is the lentiform nucleus, and we got these two parts. So if this is the lentiform nucleus, so the portion which I'm highlighting for the lentiform nucleus, this is the putamen part, isn't it? That's a putamen part here. And this part here is the caudate nucleus. That's a caudate nucleus, and that is the putamen part. I'm just using the same color. So these are the part of the neostriatum. As I said, they are connected to each other because of these striations. We call them corpus striatum, and connected in the caudal part. Whereas this portion is the globus pallidum, which is in more close approximation to the internal capsule. That is globus pallidum, also called as the pallidum part or the paleostriatum. So that is the first thing about that, how we what are the components of basal ganglia we have. We still have to talk about their connections. So guys, now let us talk about the connections of the the corpus striatum. Now, as you remember the corpus striatum part, we are talking about the putamen as well as the caudate nucleus here. Now, there are three types of afferent fibers which I've written here. That is, we have corticostriate fiber, thalamostriate fiber, and nigrostriate fiber. Well, as the name suggests, corticostriate fiber coming from the cortex, from the cerebral cortex. Thalamostriate fibers are coming from the thalamic nuclei, especially from the midline thalamic nuclei and the dorsomedial thalamic nuclei. And nigrostriate fibers are coming from the substantia nigra. So let me put it in a diagram first, that how these afferent fibers will look like. As I said, you remember more of from the pictures. And then in the next part, we will see the efferent fibers from the basal ganglia or from the corpus striatum. So guys, afferent fibers, for that, let me just again consider the same diagram. If this is the internal capsule, this here is the internal capsule. That's the lentiform nucleus, and these are the two parts. We have putamen and this is globus pallidum. Here is the caudate nucleus. And the thalamus. And as we know, this caudate nucleus, this is the caudate nucleus, and the putamen part. This is the one that you will consider in the striatum, the neostriatum. Let's say this is the cerebral cortex. This is schematically, if I put the cerebral cortex here. And because we need the fibers coming from the substantia nigra. Where is substantia nigra? In the midbrain. So there we go. Let us say this here is a section of the midbrain. And we know at the junction of the tegmentum and the cerebral peduncle, this is the substantia nigra part. So we said we have three main types of the afferent fibers which are coming into the corpus striatum. One we said is, first is corticostriate fiber. Now corticostriate, from the cortex to the corpus striatum. Now the corticostriate fibers will come mainly into the putamen. Few will come through the internal capsule and few will come through the external capsule to reach this putamen part. This is the internal capsule, right? So few are going through the internal capsule, you can see, and few are coming through the external capsule. Just lateral to lentiform nucleus, it was external capsule. We have claustrum here, and then medial to claustrum is the external capsule. So these fibers are the corticostriate fibers. These are the corticostriate fibers. These are the corticostriate fibers. That is one. Then we said, then we have thalamostriate fiber. Now from the thalamus, especially the midline nucleus of thalamus to the corpus striatum. Now majority of the fibers coming from the thalamus, they go into caudate nucleus directly. So guys, the one which are coming from the thalamus, this is, we all know this is thalamus here. So most of them, they go directly into the caudate nucleus. Not only the head of caudate nucleus, in the upper part of the caudate nucleus also. And few will go through the internal capsule. Obviously, they have to go through the internal capsule to reach what? The putamen part. So these fibers, the one that you see are from the thalamus, all these are the thalamostriate fibers. Please remember, few goes directly, most of them that goes directly into the caudate nucleus, and few have to go through the internal capsule to reach the putamen part. And third afferent, the important one, which is coming from the substantia nigra, they are the one which are reaching the putamen. This is called as nigrostriatal pathway or nigrostriatal fibers. And these nigrostriatal fibers, they are important one because the substantia nigra, this nigrostriatal fiber, they are the one which are carrying the dopamine which is synthesized in the substantia nigra. So that is the source of the dopamine which is synthesized into this in this substantia nigra part here. So this is about the afferent connection. We're just looking at the afferent here. We have corticostriate fibers, we have these thalamostriate fibers. You can see they're going in two different ways to reach the putamen. And then we have this nigrostriate fibers, which are also reaching the putamen part. So let us talk about the efferent fibers in the next diagrams. We don't want to draw everything in one diagram only. That will be a bit messed up. So guys, talking about the efferent connections of the corpus striatum. Now, first of all, please understand that majority of the efferent fibers will go from the putamen to globus pallidum. Most of them, except few which are going directly to the substantia nigra. And then from the globus pallidum, the main efferent will come out. So the main efferent of the corpus striatum, I would say, they are actually coming out of the globus pallidum part. From the basal ganglia, they are coming out of the globus pallidum part. So let's say once again, if this is the lentiform nucleus. So as I said, first of all, majority of the fibers are coming from, this was the portion which was receiving the afferent, right? That is the putamen part. So from this putamen, most of the efferent will go to the globus pallidum. That's the first thing. They will go to the globus pallidum. The efferent from the globus pallidum are supposed to go, let's say, to the thalamus. You already know that between the thalamus and this lentiform nucleus, there is internal capsule. So these fibers will reach the thalamus via two ways. Few will reach directly to the thalamus. To what nucleus? To the ventro-anterior nucleus. Some to the ventrolateral nucleus also, but mainly to the ventro-anterior nucleus of the thalamus. And few fibers will actually wind behind the posterior limb of the internal capsule. They will make a loop around the posterior limb of internal capsule to reach there. So the two ways via which the fibers are coming from this globus pallidum part to the ventro-anterior nucleus of the thalamus are these two fibers, and this is called as the fasciculus lenticularis, and this is ansa lenticularis, the one which makes a loop. If I write it separately here, the FL here is for the fasciculus lenticularis, and AL, the one which are looping behind the posterior limb of internal capsule, that is called as ansa lenticularis. That is ansa lenticularis. If let us say this here is the cerebral cortex. Now we already discussed that in the thalamus part. From this ventro-anterior, the fibers will now go to the cerebral cortex, to the motor and the premotor area of the cortex. The fibers will reach to the motor and the premotor area of the cortex. So that is one efferent connection here from the globus pallidum via two different ways. Well, not only this, the efferent coming out of the globus pallidum, they are also going to the subthalamic nuclei. If this is a thalamus, let's say here we have the subthalamic nuclei. Subthalamic nuclei. And also the fibers will be seen going to the red nucleus as well as the reticular formation in the brainstem. The efferent can be seen going to the red nucleus of the midbrain and also to the reticular formation. Also to the reticular formation of the brainstem. So these are the efferents that we see from the globus pallidum. We have the efferent to the thalamus, we got an efferent to the subthalamic nuclei, we have efferent to the red nucleus and also to the reticular formation as well. And some of them will also go to the substantia nigra, but we said that majority of the fibers to the substantia nigra will come directly from the putamen part. That is the putamen part. So these are the fibers which are going mainly to the substantia nigra. These are called as a striatonigral pathway. This is a striatonigral pathway coming from the corpus striatum and they're going to this substantia nigra, so we call them striatonigral pathway. So this is about the main efferent pathway of the basal ganglia, the corpus striatum here. So we said fibers from the putamen are going to globus pallidum, and then majority are going out of the globus pallidum here. In this entire neuronal circuitry, the one very important part here is the substantia nigra, the fibers which are going from the substantia nigra and coming back, because as we said, they are the one which serve for the dopamine there. So they are the source for the dopamine, and any injury to these fibers which are coming from the substantia nigra will lead to certain disorders, which we will discuss in the next part. And finally, regarding the functions of the basal ganglia. Now, basal ganglia is not the one which is performing the movement, but the basal ganglia is very much required for the planning and programming of the movement. Now, let me take one example here. Let's say if I'm playing a cricket and I'm standing in the slip, the ball is coming towards me. Now, when the batsman hit the ball and you got the edge and the ball is coming towards you, now you have to catch the ball, but to catch the ball, you have to plan the movement first. The execution is done by the pyramidal tract. The corticospinal tract is the tract which is taking care of all these voluntary movement. But that voluntary movement is to be planned. I have to catch a ball at certain angles, let's say in front of my face, and then it has to be coordinated by the cerebellum also. So that's the function of the basal ganglia, is to plan and program a voluntary movement. That whatever the movement is, the planning has to be done by the basal ganglia. Number two, in that planning only, the speed and the range of motion is also counted. With what speed I have to, let's say, move my hand, and what should be the range of motion. Should I catch the ball here? Should I catch it behind my body? So all those planning and programming and the execution of the speed and the range of the motion is also done by the basal ganglia part. And basal ganglia also decreases, or you can say alters the muscle tone, because decreasing the muscle tone will keep a check on the unwanted voluntary movements. If there is no check on this involuntary movement, then obviously there will be the tremors. And the best example is the Parkinsonism. Now, in case of Parkinsonism, as we know that there is a deficiency in the dopamine production, and if the dopamine is less, that means the fibers which are going from the substantia nigra to the corpus striatum part, they are the one which are being compromised. So there is no check on the corpus striatum. The corpus striatum, one which was responsible for this holding on the movement. Because of this deficiency of the dopamine, therefore the patient will have all these typical features of the Parkinsonism patient, like the stooped posture will be there is a rigidity, there is a pill rolling kind of tremors, we have a short and shuffling gait is there, and you have like micrographia is there. So all those typical features of the Parkinsonism is because of that the inhibitory action of the substantia nigra on the corpus striatum is being compromised because of either the fibers are being damaged, or maybe there is a less production of the dopamine in that case, which is keeping the check on ACH. So guys, this is about the basal ganglia part, the main part of the basal ganglia. Anatomically, you expect more of a questions about the parts of the basal ganglia, and you can expect some questions regarding the connection, especially the connection with the substantia nigra part.